guess I want you to do a month first. We want to get to that. I do want you to do that month first, so we can have an understanding of how the force is coming up. Okay? Yeah. And so and that's going to be an issue for us of direction, not so much of speed. That's for you. Okay. Okay. One more AC adjustments, and let's see. Give you my next patient. Go ahead and take your shirt off, please. And let me grab another of these. This time we're going to pull it up a little bit. Good, wind your back. Okay, so now for an inferior clavicle, these are far less common. And so again, I might have him put his hands underneath his hips. If you would, this is not so important to lock straight anymore. Again, if it's a woman, she would be stabilizing the breast in this kind of situation. But what I'm going to do now is I'm going to grasp the scapula. And I'm going to hold it inferiorly. So I'm taking an S to I pre-stress on the scapula. There's two ways to do it. I can either straddle the spine of the scapula with my index and chiropractic index finger, or I can grasp the clavicle, the scapula, the spine of the scapula with my fingers, like this. So if I can show it on here, you can just relax. I feel for the only bony thing back there, and I'm pulling inferiorly as I do this, or I can bring my hand back this way, and I'm pulling inferiorly as I do this. Either one is fine. Now, in this position, I'm going to contact the clavicle, and I'm going to use a lot of tissue pull. And we got to be careful. So one of the mistakes would be to contact with my pisiform and push right in on the coracoid process, and thinking you're grabbing the clavicle, and it hurts like hell. So to avoid that, I'm going to keep my hand very flat. I'm not going to do this, which we do with every other adjustment we do. Keep the hand very flat and take a lot of tissue pull to make my contact. So it's a soft contact, a broad contact with a broad portion of my hypothenar eminence. I'm going to pre-stress by holding the scapula down. I'm going to take my contact and do a pre-stress by stressing the clavicle superiorly with a little bit of A to P force. Feel the tension, and then thrust. That's for an inferior clavicle. Questions? Okay, so now let's take a look at the scapular subluxation. So let me ask you to lie on your stomach now. Okay, so superior scapula, inferior scapula, how do we do these? Okay. You guys can all see this well with your video?
I'm gonna make this available for everyone. So.
That's great. And when you do, let me know. I can throw it on the bright space.
Okay.
And if it's really all right with you, I can use it next quarter or two.
Sure.
Okay, so now we're going to stabilize the shoulder girdle by placing the palm underneath the humeral head. The forearm is going to stabilize his arm, not his forearm, but his arm. And we have this position if it's comfortable. It's better. For some patients, it's not comfortable. It can be very tight. Slipping the hand underneath the ASIS is another option. But it works better if this is comfortable. Is that comfortable for you?
Yeah.
Okay, good. And so notice what I'm doing here. It's very important what I'm doing here. I'm not doing this. This is extending the humerus. It's not moving the scapula. I'm doing this. I'm lifting with my palm of my hand, and I'm retracting the scapula. So that's a very important distinction where people sometimes make that mistake. And then we always say the same thing. Let your shoulder just fall into my hand. And when he does that, it always loosens things a little bit. And so now when I retract, I'm separating the scapula from the thorax, which then allows me to push the scapula inferiorly. If I don't do that, I'm just jamming the scapula into the ribs. And so very important to do that little bit of retraction. Feel the most superior medial corner of the scapula. Take a hypothenar eminence right on that superior medial corner of the scapula. Turn my body to face inferiorly. So I'm using my whole body to make the stress and then thrust from S to I. That's for a superior scapula. Any questions? The analogous and inferior scapula. Now I'm just going to turn my way around. Turn around in this position. Use the other hand and forearm again to stabilize the humeral head and arm. So notice that I'm stabilizing the arm here, not the forearm. And I say relax, and I'm going to lift here. I'm going to relax here. I'm not doing this. I'm not extending the humerus. I'm retracting the scapula. And here I can feel the inferior angle of the scapula right here. And I take a thumb web contact on the inferior angle of the scapula. And now I push superiorly. Both hands are moving, taking as far as it will go in a superior direction. And then I stress and thrust in that position if it's fixated. That's for an inferior scapula. Superior, inferior. Any questions? Now, remember, this next part will not be on the test. But you can modify this adjustment to either abduct or adduct the scapula. So I can use my fingers to laterally move the inferior angle, so that's abduct the scapula and thrust, or my thumb to medially move the scapula or adduct the scapula and thrust. And of course I'm creating counter forces with my hand in this process. Okay, stay where you are, let this relax. Questions? We learned a few rib adjustments as well, just to kind of remind you of these things. Again, this can be on the test as well. And so kind of how do these things work? Remember that ribs tend to subluxate superiorly because of your levator costorum. Sometimes the lower six can subluxate inferiorly. Rib subluxations, they can hurt like hell. They can be dramatic and oftentimes relieve very significantly with adjustments. And so remember, when it comes to the ribs, you want to come lateral to make your contacts. So you need to know where your stuff is. Lateral border. By the way, the borders, I don't know if I listed there. Structures you'll be asked to palpate will also include, if it's not listed there, the spine of the scapula and the medial border of the scapula. So the medial border of the scapula for him is right here, so I want to go medial to that to make my contact to adjust the ribs. The more lateral I'm on the rib, the more leverage I have to move the joints. Of course, the joints I'm moving are the costotransverse joints and also the joints that attach the ribs to the vertebral bodies. For a superior rib, I use my superior hand as contact, and I stress from S to I, right on that rib. And then to pre-stress the costotransverse joint, I go to the opposite TP. There we go. And I'm going to go directly P to A for the opposite TP. Then I'm going to stress and thrust from S to I on the rib. And you can do this while he takes a whole breath in and holds it. I'm just going to take a breath in and hold it. Good. And then I can stress and thrust, or he can let all the air out. And I can do the stress and thrust. And so some works better than others. It ups, patients are different. It gives you options in those situations. You're stretching the tissues more when he holds the breath. You're relaxing the muscles more when he lets the breath out. So that's for a superior rib. For an inferior rib, it's just the same opposite, except remember these are just the lower ribs that tend to go in that position. And so again, inferior to superior contact on the rib, I find the opposite TP, I contact that with a pisiform, takes a breath in, I stress and thrust, he lets the breath out. I stress and thrust, and it's up to you to choose one of those, and again, sometimes one works better than the other. It's not always easy to predict. We learned a particular first rib adjustment. Now you learned last quarter a first rib adjustment, I believe, where you laterally flex the neck toward the side of the first rib. We're just giving you another options. These are options. These are laterally flexing the neck away from the side of contact of the ribs. And so in this case, the first rib, it's just way up there, as high as you can go. So we have the curvature of the trunk. And I'm going to take a tissue pull over the top, so right at the top of the trunk, when I reach that, I put my pisiform very close to my hand. Let me do this on the other side. No, I guess you guys can see. So that I can move the mastoid. So I'm not just rotating the head. I'm distracting and laterally flexing when I do this. Leaning my body way superior so that when I drop on it, I'm stressing and thrusting from superior to inferior and P to A. So you can see, you can see on the other side, this would be my contact way up here. Notice I'm right next to my hand and underneath the mastoid so I can distract and rotate. Lean my body way high before I stress and thrust S to I. Got it?